Hello again. Thank you, Nancy, and to the panelists for that really great start to the day. We have a lot of really great pieces of information and tools to work with throughout our discussions, and I'm really looking forward to the next session. But before we begin talking about health and science disinformation, which is a topic that's troubling and very near and dear to my heart, I'd be remiss in my duties as MIF board chair if I didn't take a moment to say thank you to those of you in the room who are members of MIF, which is, after all, a member-supported institution and network. I hope for those of you who are not members that you consider joining MIF. This Journalism Funders Gathering has sparked several consequential collaborations over the years, and a lot of that work has been furthered and facilitated by the efforts of MIF and its staff. Today, of course, isn't the only time that we pull people together through this network. Throughout the year, there's lots of other opportunities through MIF to connect meaningfully and strategically through webinars and other in-person events and through strategic communications. If you're eager to hear more examples of MIF's impact on this network, I officially volunteer Eric Newton and John Funabecki to tell you more, since, as we heard earlier, they've been with us since the start. But now I'd like to introduce one of my KFF colleagues, Dr. Céline Gounder, a senior fellow and editor-at-large for public health at Kaiser Health News. Céline is one of the best thinkers and talkers on the subjects of infectious disease, public health, and health misinformation, a topic on which she's testified before the US Congress. If you don't follow her on @CélineGounder on Twitter, you should. Céline is a physician, an epidemiologist, and a medical contributor at CBS News, and spreads a lot of health and public health information through many, many different channels. I'd also like to give a shout out to Irving Washington, who just gave us an update from his role on AJP's board. But as you may have heard, he'll be joining Céline and me at KFF later this year to lead development of a new program we're initiating on health mis and disinformation. But without further ado, please join me in welcoming Céline to update us on the state of affairs in health information and to guide us through that topic. Thank you, Céline.
Thanks, David, and welcome as well to Irving. We look forward to having you join us at KFF very soon. As many of you may already be familiar, the Kaiser Family Foundation has 4 main programs, which include Kaiser Health News, our editorially independent newsroom, our policy and polling teams, as well as our social media impact team. Prior to the pandemic, Kaiser Health News, or KHN, was already reporting about misinformation in the worlds of healthcare and health policy. We wrote about various forms of misinformation, ginned up to torpedo the Affordable Care Act, also known as Obamacare. We wrote about so-called death panels, which were in reality an effort under the Obama administration to take into account the cost-effectiveness of various health interventions, as do other countries like the UK with its National Institute for Health and Care Excellence. Our newsroom reported on misinformation about HIPAA, about people not understanding that there are exceptions to the privacy law that allow healthcare providers to talk to family or caregivers when a patient is a danger to themselves or others. Later, we reported on why some families went without health insurance for themselves and their kids, misled by misinformation that doing so would jeopardize their immigration status. In April of 2019, and just in time for the COVID pandemic, KHN and PolitiFact announced a 2-year health-related fact-checking partnership. PolitiFact staffers trained and worked with KHN's editorial team to report, write, and edit content using PolitiFact's fact-checking methodology. And over the course of the pandemic, our reporting on misinformation and health has scaled up dramatically, with over 50 articles since the pandemic began, in addition to multiple episodes of our What the Health podcast with Julie Rovner. Early in the pandemic, we debunked conspiracy theories about what contact tracers did. No, people were not being sent to non-existent FEMA camps. Contact tracing wasn't part of a ploy by global elites such as the Clinton Foundation, Bill Gates, or George Soros. Before COVID vaccines were available, our reporters were debunking claims made by Dr. Stella Emanuel and America's frontline doctors that hydroxychloroquine was a cure for COVID, as well as misinformation that testing sites were infecting people with COVID. We showed how online COVID patient support groups became a Trojan horse for misinformation, and how some Facebook group administrators are fighting back on COVID misinformation through their moderation of posts. The newsroom showed how politicians, influential TV and radio hosts, and online skeptics were incentivized to downplay the threat of COVID. We explained why Black Americans were getting vaccinated against COVID at lower rates than white Americans in early 2021, and how misinformation led to higher COVID death rates in rural America. We showed how COVID misinformation contributed to the high number of preventable COVID deaths in 2021 after vaccines became available and surpassing COVID deaths in 2020. We brought you the stories of patients who ended up in the hospital with severe COVID, swayed by internet misinformation not to get vaccinated. We went to Central California and the South to show how community health workers and Black churches are fighting misinformation about COVID and vaccines in their communities. The KHN newsroom covered misinformation about COVID and vaccines among immigrant and refugee communities and explained why credible Spanish language information is needed to dispel vaccine misinformation among migrant farm workers and other vulnerable populations. Our reporters wrote about how misinformation made some undocumented immigrants who have good reason to be fearful and distrustful of government and law enforcement reluctant to get vaccinated. We explained why they might be hesitant to get vaccinated, worried microchips in the vaccines would allow the government to track them. The newsroom documented the impact of misinformation on vaccination rates, everywhere from nursing homes to professional sports leagues. We reported on the removal of a YouTube video featuring Florida Governor Ron DeSantis and controversial scientists containing false statements about the efficacy of children's mask wearing and the blowback that then ensued. Our reporters explained how RFK Jr.'s Children's Health Defense exploited a moment of heightened national attention on racial injustices and health disparities following the murder of George Floyd with an anti-vaccine film targeted at Black people. We fact-checked claims that COVID PCR tests cannot differentiate between COVID and the flu. We showed how misinformation has been a source of repeated trauma and grief for some families. First, when they've lost loved ones to COVID who, believing misinformation, didn't take precautions to protect themselves. And then later, when others, again influenced by misinformation, dismissed or stigmatized those deaths. Our newsroom reported on the Center for Countering Digital Hate's Disinformation Dozen, the 12 people or groups responsible for more than 2/3 of COVID disinformation on Facebook. In addition, KHN identified 20 additional doctors who have made false or misleading claims about COVID by combing through published fact checks and other news coverage. We've written about why some states have had to ban harassment at vaccination sites and how California lawmakers are pushing for tough legislation on COVID misinformation. We brought you stories about how misinformation campaigns have fueled parental concerns about vaccine safety and depressed COVID vaccination rates among kids. The KHN newsroom wrote about how notorious COVID misinformation spreaders have influenced elected officials, who in turn have blocked the appointment of public health leaders at a time when at least 1 in 5 Americans live in places that have lost their top public health official amid a wave of firings, resignations, and retirements since the pandemic began. Our reporters showed how political pressure on medical boards has led some to turn a blind eye on doctors spreading misinformation. The KHN newsroom also wrote about how anti-vaccine groups targeted pregnant women, flooding social media with misinformation about impaired fertility and harm to the fetus. But our work over the last couple years hasn't just been focused on misinformation about COVID. More recently, we've covered the history of Plan B emergency contraception and misinformation in the form of product labeling. The company agreed to unscientific, incorrect labeling to get its application approved more quickly in the face of pressure from anti-abortion activists. This product labeling has been used to justify excluding Plan B from government family planning programs and contraception coverage mandates. The KHN newsroom wrote about anti-abortion activists who falsely claimed that birth control would remain easily available in the wake of the Supreme Court's decision overturning Roe v. Wade. So far, no state has banned specific forms of contraception, but the threat appears very real. We warned you about misinformation about monkeypox that began circulating on social media at the beginning of that outbreak. KHN's reporting has been co-published with national and local media outlets including Time, US News and World Report, CNN, NBC News, The Washington Post, The Guardian, Politico, and many others. We've also partnered with NPR and local NPR affiliates, as well as Spanish language radio, to get out our stories on misinformation. Meanwhile, over the pandemic, KFF's policy research and polling teams have been busy as well. KFF's COVID vaccine monitor became one of the most important sources of information about the public's attitudes on COVID, mitigation measures, vaccines, and misinformation, and has tracked information gaps as well as identified trusted messengers and messages. In November 2021, just before COVID vaccines were to roll out, our polling found that almost 80% of adults had heard at least one false statement about COVID that they believed to be true or were unsure might be true. We found that COVID misinformation was correlated with vaccination status, partisanship, and the news sources people trust. KFF's polling found that no news media source had the trust of the majority of the public when it comes to COVID information. KFF researchers also found that most adults, about 60%, thought the government was exaggerating the number of COVID deaths. 4 in 10 said they heard that pregnant women should not get the COVID vaccine, and 3 in 10 had heard that the vaccine had been shown to cause infertility. 6 months later, in May of 2022, KFF researchers found that misinformation about COVID remained persistent. They remained especially skeptical of the safety of COVID vaccines in pregnant women and children. We live in a moment of great uncertainty and confusion, an era of truth decay. The rampant spread of mis and disinformation have made it difficult for Americans to agree on objective facts. It's making us more skeptical of science, government institutions, and the media, and it's corrupted our civic discourse. Without a common set of facts, it's difficult to come to a consensus on what problems the country is facing, much less the policies and solutions to solve those problems. And as journalists, it's our professional responsibility to communicate about science and health accurately and responsibly, and to not only debunk mis and disinformation, but also to report on the phenomenon and its impact itself. Thank you.